Welcome back. Albert Einstein College of Medicine researchers and their colleagues have found a key cause of severe kidney complications affecting many lupus patients and are now conducting a clinical trial to evaluate a promising treatment that's aimed at preventing those complications. Joining us now and sharing more details, we're pleased to have the professor of medicine and microbiology and immunology at Albert Einstein's College of Medicine, Dr. Chaim Putterman. And Dr. Putterman, glad to have you with us.
Thank you very much. Thank you for inviting me.
Thank you. And so it's got to be an exciting time for this research group and the colleagues as you're looking at your findings. So give us a little bit when it comes to the area of lupus about where we are today.
Sure. Well, maybe a little bit of a background about lupus. The immune system is getting a lot of press now in these days of COVID. And lupus, very briefly, is a disease in which the immune system is hyperactive. It's too active. It's active against the body's own tissue and against the body's own cells and against the body's own organs. And when that happens, there's damage, what we call autoimmune damage or self-induced damage to many organs in the case of lupus.
And so when we talk about lupus and we talk about these breakthroughs that we heard, talk to us about what we're finding out by way of these researchers and Albert Einstein College of Medicine.
Sure. So physicians nowadays are using a really broad array of different types of medication to treat the hyperactive immune system. Specifically, one of the major problems that we're trying to target in our treatment is what we call lupus nephritis, or kidney inflammation due to lupus, which is a condition which is actually quite common among patients with lupus, and in fact is more common in patients of African American and Hispanic descent. So there's a disease that involves the kidney, causes kidney inflammation, and we need to treat it. As I mentioned, there is effective treatment. However, that treatment is what we call non-specific. It's not sufficiently targeted. It targets the immune system, but several different types of cells are targeted, and therefore one of the side effects of this non-specific targeting of the immune system is immune suppression, is suppressing the ability of the immune system to fight off invaders. And what really we're trying to do and other investigators are trying to do is find more specific types of therapy, more targeted to specific cell types and not broadly suppress the immune system. So we'll get just as good results or maybe even better, but with less side effects.
Can we give us a little bit of insight into what kind of clinical care is available for those who have lupus right now? I mean, we know that more and more Americans are being affected by this, but talk to us about the clinical care that's actually available.
So at the Albert Einstein College of Medicine and our affiliated hospitals, we are really very interested in invested in the care of lupus patients. And that is because just the demographic breakdown of the borough is so skewed towards minority populations who are disproportionately affected by lupus. Therefore, Albert Einstein and its hospitals treat many lupus patients. We have a large lupus center at Montefiore, at Jacobi, other hospitals that are affiliated with us, which provide treatment to all ages. We have pediatric lupus patients, we have adult lupus patients, and we try to give all the possible and necessary treatments that lupus patients to be able to them to maximize their potential, their dreams, to be able to live with the disease instead of being really hobbled by it or not being able to function in their daily life because of the disease severity and its complications.
So what other research is going on concerning lupus at Einstein right about now?
So there's several clinical trials in lupus. So let me say one or two sentences about the actual research that we just published about. So one of the cell types, one of the immune cell types that participates in the damage in kidney inflammation in lupus is called T cells. And the type of therapy which we showed was effective in preclinical models, we showed that blocking a specific set of interacting molecules present on the T cells and in other cells called CD6 and ALCAM that was very effective in treating the complications of lupus nephritis in our animal models. Because of this idea, and because we also saw that this particular pathway, that this particular couple of CD6 and ALCAM, as we call these immune molecules, were also present in lupus kidneys, in human lupus kidneys. And we found evidence for high levels of ALCAM in the urine of patients that had lupus nephritis. All this suggests that whatever we find in mice is also potentially applicable to humans. And now the clinical trial that we are currently engaging in is to see whether blocking an antibody blocking CD6, this particular molecule in T cells, will be effective and safe for patients with lupus nephritis. There are other clinical trials which are taking place at Einstein. Again, we are looking for all the time, it's very important to us to get the best medication to the patients in the Bronx who need it.
Is there a particular group that's highly impacted by this disease the most?
Yes, unfortunately, it is a disease which is not only more prevalent, but also more severe in African Americans and Hispanics. And we know these are populations which are very present in the Bronx. We see a more skewed and more severe type of disease. We see more complications. We saw more progression towards end-stage renal disease. So these are populations of patients or groups of patients that we really care a lot about and need to be able to prevent lupus from affecting them as it could.
Yeah. And so with regards to symptoms, what are some of the major symptoms that people have that maybe not be so familiar with that should be going out and getting tested for lupus?
So lupus is what we call a multi-system disease. It involves multiple organs. But before that, there are specific populations in which the index of suspicion is particularly high. Most patients with lupus, the large majority, in fact, are women. Lupus in men is much less common. Also, most of the women with lupus are in a specific age range, between the ages of 15 and 45. So first of all, we want to have the particular demographic. So if a woman, a young woman from African American ancestry comes into your clinic, you're already much more thinking about lupus as a possible explanation for complaints. And then the second thing that makes us think about lupus is, again, the multi-system nature of the disease. They don't only come in with disease affecting their joints or their kidney or their skin or their heart, or rather it's a disease that at the same time can affect several different types of tissues and organs.
So for people who want more information, how do they go about getting more information with regards to this? Because there are so many things that people do need to know, but unfortunately, the window of information for some, or I should say access to information for some, is not always readily available.
Well, I'm glad to say in the case in lupus, that's not the case, that really there's a lot of excellent information out there. There's several patient organizations that have put together high-level, approachable, clear, understandable patient information. This is not informational, these are not scientific articles for physicians, these are for patients. What do you need to do? What do you need to look out for? How do you need to take their medications? And they're really very approachable, and they're very happy to help any lupus patients from whatever borough that gives them a call or contacts them through social media.
All righty. Dr. Chaim Putterman, thank you so much for being with us and sharing with us some much needed information when it comes to the area of lupus. Thanks for joining us, I should say.
You're welcome. Thank you very much.
All righty. Well, I want to let you know if you want more information, please visit the website, einsteinmed.edu, and also follow them on Twitter and Instagram at einsteinmed. Well, we do have more show. We don't want you to go anywhere. Open continues coming up right after this.